Welcome everyone. So now we are going to start a topic that is hiatal hernia. Now it is defined as herniation of stomach upward into the chest cavity through esophageal hiatus of diaphragm. Now, as in basic anatomy, we understood that diaphragm has openings for esophagus and aorta. So now when esophagus descends down from diaphragm and it is connected with the stomach, but what happens because of certain factors, certain problems, this esophagus is herniated upward into the hiatus opening of esophagus. The stomach also goes upward, and then the condition develops that is hiatal hernia. It occurs due to separation of diaphragmatic crura and widening of the space between muscular crura and esophageal wall. Now, types of hernia, hiatal hernia are sliding hernia. It is also known as axial hernia. Another is rolling hernia. This is known as non-axial hernia. Now, sliding hernia is most common type. It is it occurs in 95% of the cases, and it refers to the herniation of proximal stomach through the widened diaphragmatic hiatus, and the gastroesophageal junction is displaced above the diaphragm. While in rolling hernia, it is also known as paraesophageal hernia. Herniation of portion of stomach for greater curvature along with distal esophagus is herniated upward in the opening, and gastroesophageal junction remains at level of diaphragm. So this is the difference between rolling and axial hernia. Now, clinical features of the hiatal hernia are often asymptomatic. Sometimes patient becomes asymptomatic. No significant symptoms are observed in the patient. It is commonly an incidental finding in chest X-ray when a patient goes into the hospital for other problem, and incidentally patient is prescribed to go for chest X-ray. Then this condition can be diagnosed. Heartburn and regurgitation can occur in this patient, and paraesophageal hernia can cause gastric volvulus. Gastric volvulus is twisting of the mesentery with its own and compromise blood supply to the gut, which can present with the abdominal pain. So it may develop gastric volvulus. Now the complication of hiatal hernia are ulceration, bleeding, perforation, and strangulation occurs. Ulceration is the loss of epithelium, loss of mucosa. Bleeding will be occur. Perforation means rupture of the esophagus or stomach can be there, and strangulation will be occur when there is compromised blood supply. That is hiatal hernia. Now, esophageal diverticula. A diverticula is a outpouching of the alimentary tract. Now, let's suppose this is esophagus. This is normal esophagus, but in uh, diverticula, what happens? Outpouching occurs like this. Pouches of esophagus develop like this, small pouches. So that is known as outpouching of the esophageal alimentary tract, and it can be true or false diverticulum. True diverticulum is outpouching and is lined by mucosa, submucosa, muscularis propria, and serosa, while false diverticulum is outpouching lined by mucosa and submucosa only. Two types of diverticulum occurs: Zenker diverticulum, and it is known as paraesophageal diverticulum. It occurs around the esophagus. It is known as pharyngeal pouch, most common type of the esophageal diverticulum. It is defined as outpouching through cricopharyngeus muscle above the esophageal sphincter, protrudes through natural weak point Killian dehiscence, and constrictor of the pharyngeo cricopharyngeal muscles. Now, the pathogenesis is disorder cricopharyngeal motor system can lead to this condition with or without gastroesophageal reflux disease. It is present diminished luminal size of upper esophageal sphincter can cause this condition. Clinical feature of this diverticulum is dysphagia. Regurgitation occurs because the food particles are remains in the outpouching, and the mass in neck will be observed. Halitosis, bad breath occurs because of entrapped food. Bad breath occurs. Another type is tractional diverticulum. It is located near the midpoint of esophagus, can be caused by scarring resulting from mediastinal lymphadenitis from TB, and it is generally asymptomatic. No symptoms will be complained by patient. Epiphanic diverticulum, another type of diverticulum, it is located immediately above lower esophageal sphincter. That's why known as epiphanic above the diaphragm diverticulum. It is caused by discoordinated peristalsis and lower esophageal sphincter relaxation, and present with natural regurgitation and massive amount of fluid occurs in this type of diverticulum, epiphanic diverticulum. So this was the disease diverticulum. In next video we will discuss other disease of the esophagus.